the last lesson, we discussed what it means to be at risk for disease. Depending on the condition or illness being examined, the population considered at risk can vary greatly. Some of the groups commonly considered at risk for disease include children, the elderly, minorities, the homeless, immigrants, war veterans, the mentally ill or disabled, and those living in poverty. This is not to say that every person who is in one of these at-risk groups will suffer from disease. These groups are generally considered at risk simply because they are disproportionately affected by many diseases. A lot of effort is put into decreasing the risk for disease amongst these groups. Some risk factors, like age for example, cannot be helped. It is the natural progression of life to start out as a child and grow older. Similarly, we cannot change whether a person is a minority. There are, however, some risk factors that can be helped. Poverty is one of those factors. If humanity could eliminate poverty, many health issues could be diminished or even eradicated completely. For this reason, many government agencies and programs in the United States and across the globe offer assistance to those in need in order to fight poverty. The U.S. Census Bureau defines poverty based on a family's income and the number of people living in the family. Oftentimes, people living in poverty struggle to obtain food, housing, or health care. Government assistance programs can help to make ends meet for families in need. The U.S. Department of Housing and Urban Development established public housing programs to provide decent and safe rental housing for low-income families. Medicaid is a health care program that provides health insurance for U.S. citizens whose income and resources are not sufficient to pay for health care. The Children's Health Insurance Program, also known as CHIP, provides health coverage to eligible children. The Health Resources and Services Administration, or HRSA, is a federal agency that aims to improve access to health care services for people who are uninsured or medically vulnerable by funding community health centers around the country. To reduce the risk of nutrition problems for people living in poverty, the Department of Agriculture has created several food programs. Women, Infants, and Children, also called WIC, is a federal program that safeguards the health of low-income women, infants, and children up to age 5 by providing nutritious food to supplement diets, information on healthy eating, and referrals to health care. The National School Lunch Program provides nutritionally balanced, low-cost, or free lunches to needy children at school. The School Breakfast Program is similar and provides nutritionally balanced, low-cost, or free breakfasts. When school is out for the summer, children in low-income areas are provided with free, nutritious meals and snacks through the Summer Food Service Program. The Supplemental Nutrition Assistance Program, or SNAP, is the nation's largest nutrition assistance program. It serves low-income U.S. citizens and lawfully present non-citizens by providing electronic debit cards that can be used to purchase food. Other nutrition programs include the After School Snacks Program and the Special Milk Program. All of these programs require that the participants apply for them in their local community. Most schools send applications home with students at the beginning of the year for the school-based programs. To apply for SNAP, individuals must fill out an application and bring it to their local SNAP office. Some people do not apply for nutrition assistance programs even though they are eligible for benefits. These people may not be aware of the programs or how to apply for them. They may think that they would not qualify, and sometimes they feel too proud to accept help from the government. Regardless, these programs exist for a reason. It is so important for people to receive the help they need, particularly when it comes to nutrition. Children especially need good nutrition so they can realize their full potential as adults. These government assistance programs help to level the playing field so families struggling to get by can make ends meet.